Okay, here we go. This is health for the 30th of March. We're not quite here yet. We're more like right here. There we go. Okay. Might as well go and do this and see what happens. Okay, so we got through alcohol. Now we're going to talk about tobacco. Smoking peaked in the United States in the early 1960s. About half the men and one-third of the women smoked. It was just under half of the population of the United States was smoking at that time. I think I've told you about it. If you went into somebody's house, it always smelled like tobacco. Always smelled like smoked cigarettes, old smoked cigarettes. And everybody had ashtrays sitting all over their houses just because a lot of people came in who were smokers, even if they weren't, even if they didn't normally have smokers in their house. If somebody came in your house, they would, a lot of times, they just light up. It was just the way things went. Now, of course, a lot of people try to keep tobacco smells out of their house, but back then that wasn't the way it was. Today, 19.8% of the U.S. adults smoke, so it has gone down from around 50% to 19.8%. Most of the decrease occurred among upper socioeconomic status groups in men. Lower socioeconomic status men continue to smoke. Smoking among women increased sharply because there were strictures against it. There's some places that it was frowned upon, but after in the 1970s, of course, we had women's liberation that took place, and one of the things they started doing was smoking. My sister. My sister was never all that healthy. She hated exercising, but she was a feminist, and in the 1960s she started smoking women's cigarettes. Women's cigarettes, Virginia Slims is a good example of them. There were several brands that marketed their cigarettes for women. They were thinner and they were longer, as weird as that is, and they had patterns on the cigarette paper, as strange as that may seem. Anyway, so she started smoking. It only lasted for a couple of months. After that, she realized, yuck, it tastes horrible, and she didn't like it. So she was in her 20s at the time, I guess. Yeah, she was in her 20s. Smoking rebounded among U.S. teens in the late 1990s, and the reason it did is because they started advertising toward children, toward kids, and Joe Cool and the rest of that stuff, and so there were a lot more people that were smoking. Smoking is increasingly prevalent in Asian countries and developing parts of the world. It's really kind of weird in Japan. If you go to Japan or China, they will take the tobacco, they will take the smoke into their mouths, and then instead of breathing it down into their lungs, they'll swallow it into their stomachs. And for that reason, there is high levels of stomach cancer in the Asian countries caused by the tobacco. They don't have the same levels of lung cancer, but they do have higher levels of stomach cancer. Smoking is the most prevalent among American Indian Alaska Natives. About 36.4% of American Indian Alaska Natives do smoke. Some tribes will say that the reason they smoke is because it's holy, but normally what they're talking about is not the cigarettes that people actually smoke. It's kinnick, or it has, you guys smoke mountain tobacco, which is pure tobacco. It's not mixed with all the other god-awful things that they put in cigarettes. The second most prevalent group that smokes are white adults between the ages of 18 and 24. About 21.4% of those idiots smoke. African American adults smoke at a much lower level at 19.8%, and then Asian Americans smoke at a rate of 9.6%. Many teenagers begin to experiment with smoking during middle school, and high school. By grade 12, about 13% of boys and 11% of girls are frequent smokers. And this is defined as having smoked cigarettes on 20 or more of the past 30 days, which means that's only one cigarette per day. But that's what's going on. Cigarette smoking is the single most preventable cause of illness, disability, and premature death in much of the world. The mortality rate for smokers is 70% higher than for non-smokers. And this is one of the reasons why educated people tend not to smoke, whereas non-educated people are still smokers. Half of all deaths due to cardiovascular disease, lung cancer, and chronic obstructive pulmonary disease are smoking related. And of course, we have this outbreak of the coronavirus, and one group that it's killing is the people with chronic obstructive pulmonary disease. This thing, what happens with coronavirus, once it starts, after about 5 days that you've had it, it will start flooding your lungs with mucus, with fluid. So if you've already got chronic obstructive pulmonary disease, where your lungs, your chest doesn't really move very well anyway, and you have a hard time breathing, you're a goner, and those are usually the people that are dying very quickly. An adult who has smoked 2 packs per day for 20 years can expect to lose 8 years off of their life. BPDE, benzoapyrene diol epoxide, is a chemical in cigarette smoke. It is a causative agent in lung cancer. BPDE damages a cancer suppressor gene, causing lung tissue to mutate. Women are more susceptible to the carcinogens in tobacco than men are. Nicotine causes serum cholesterol to go up. It increases risk of miscarriage, sudden infant death, and low birth weight infants and pregnant women. So it is really kind of foolish for women to smoke. However, back in the 1950s and 1960s, doctors used to tell women who had severe morning sickness during their pregnancies to smoke cigarettes, and that would help them get over the morning sickness. As dumb as that sounds, back then they didn't realize, or actually, there were a lot of people that were pretty sure that tobacco was a pretty bad gamble, but officially nobody could say that tobacco was bad, because the tobacco companies, of course, in the United States, just like right now, this whole coronavirus thing could turn into a question of, are we making enough money? Is money more important than human life? And the answer is always going to be, with people with a lot of money, is that money is more important than poor people. They don't really care about poor people. They don't care about anybody except their money. And as long as they're not the ones dying, they don't really care. So we may come down to the same conclusion. That's what happened with tobacco. That's what has happened with alcohol. The whole reason that they took the ban off of alcohol before the Revolutionary War was so that they could make money. They could get the revenue. The whole reason they stopped prohibition, it was working. Prohibition really was working. But the whole reason that they took prohibition, they changed prohibition, or they took the stricture off of prohibition, was because of money. They needed the money. This was during the Depression. So money was more important than human lives. Once again, and as always in the United States, money is more important than human lives. And this is the effects of aging. As you can see, the lady on the left is looks like she's getting older. This is her on the right. On the right, I can get there we go. This lady is the same lady, and this is her. This is her when she was a smoker, and this is her after she had given up cigarettes. So as you can see, her face tightened up and whatnot. Environmental tobacco smoke, ETS, contains an even higher concentration of many carcinogens. This is known as secondhand smoke. Non-smokers who are regularly exposed to ETS are at increased risk for cardiovascular disease. There's firsthand smoke, that's the smoke you take into your lungs, but secondhand smoke is the smoke that goes into the air. That's secondhand smoke. Thirdhand smoke is the residue that lands on the furniture, on the walls, and that's third-hand smoke, and that's also dangerous. There are carcinogens in third-hand smoke as well. Initial use is unpleasant. Social contacts, role modeling, and peer influence very often will lead many teenagers to start smoking. And it's not because it tastes so great, it's because it is something that everybody's doing. Advertising plays a major role in this. It looks cool. If you watch a movie from the 1930s or the 1940s, everybody smoked. Everybody drank big glasses of alcohol. And of course that had to do with what was going on in the culture at the time. So everybody smoked. The coolest people smoked. Humphrey Bogart, of course, made a living out of being the cool guy that smokes. He was an actor in the 1940s, died in the 1950s of lung cancer, of course. John Wayne, another icon of the 1940s and 1950s, also died of lung cancer. As a matter of fact, when he made True Grit, the movie that he made that he was awarded the Oscar for, he had just had one of his lungs removed because of lung cancer. And of course, he died a couple of years later. Vulnerability factors in teens who start smoking: low feelings of competence and control, perception of lack of social support. They are rebellious, and this is a way of showing their rebellion. They're not supposed to do it. It's illegal for them to buy cigarettes, but here they're doing it anyway. Strong need for independence, of course, and stress management. They have the cigarettes help them control their stress. Biological factors come into play as heavy smokers develop dependence on nicotine. Reinforcing properties of smoking: the nicotine stimulates the sympathetic nervous system, causing the release of catecholamines and serotonin, stimulating dopamine release in the brain's reward system, and inducing relaxation. And of course, every time you take a puff on that cigarette, you get a dopamine spike in your brain. And of course, dopamine feels good. It's almost like amphetamines. It's like a jolt of amphetamines. So that's what's happening in people's brains. And you can imagine if you get 10 or 15 of these things in any cigarette, you get 15 bumps of amphetamines. It probably makes you feel pretty good. And that's why they continue to do it. Schachter and colleagues first introduced the nicotine titration model in 1977. The nicotine titration model theory is that smokers who are physically dependent on nicotine regulate their smoking to maintain a steady level of the drug in their bodies. And if you watch people smoke, the nicotine titration model has to do with how often you take a puff and how strong the cigarette is. And if you watch people smoke, a lot of times they'll just stand there with the cigarette. And it's not like they need the nicotine and they're puffing the thing down to ashes and then they're lighting another cigarette. That's not usually what's happening. If you watch people smoke cigarettes, they will take puffs of the cigarette, but then they'll wait for 10 or 15 seconds before they take another puff. A lot of people will take a puff, they'll wait for a minute or so, and then they'll take another puff, then they'll wait for another minute, and they'll take another puff, and by that time it's burned down and they'll put the thing out. They've taken 3 puffs of the cigarette. How much nicotine are they getting in their system? Well, that's actually what is going on. As far as Schachter is concerned, individuals who smoke need a certain level of nicotine in their system. They're not going to smoke more than they need. If they do, it'll make them sick. but they need a certain amount in their bodies, so they will take a select amount of nicotine into their system, and that's why they smoke. Schachter discovered that the most smokers smoke approximately the same number of cigarettes a day, hence attempting to maintain a select titration in their system. This happened in the 1970s. You remember that smoking didn't decrease. This is when we first discovered that nicotine. Well, we didn't first discover it at this point. It was known. It had been known for a while, but the tobacco companies sued anybody that would say that tobacco was bad for you. There were actually studies that said tobacco was good for you, as bizarre as that may seem. So Schachter was looking at this, trying to figure out why in the world do they smoke 7 cigarettes a day? Why is it always 7 cigarettes a day? Why isn't it 8? Why isn't it 10? Why isn't it 15? It's a stressful day. Why aren't they smoking more cigarettes? Well, what happens is they're trying to maintain a select amount of nicotine in their system. And this is the way he experimented. This is the experiment that he made. He had different levels of nicotine in cigarettes, and he gave high-level nicotine cigarettes to some people and low levels to others. And of course, he knew how many cigarettes they smoked a day. I was just watching a movie. They were saying that Sterling Hayden, a famous actor, was a pack-a-day smoker. Well, that's 20 cigarettes a day. 20 cigarettes, that's you've got one in your mouth just about every hour of the day. But they wanted, and they he was playing a mean a police officer, and the way they made him meaner is by not letting him smoke on the set. So he wasn't getting the cigarettes he was accustomed to, and because of that, he was pretty grouchy. And that's the character that they wanted. Okay, so Schachter had levels of nicotine in cigarettes, and he gave the high nicotine. When he gave high nicotine cigarettes to an individual, they would smoke fewer cigarettes. When he gave the low nicotine cigarettes to an individual, they would smoke more cigarettes to make up for the nicotine they had lost. So people are trying to maintain a select amount of nicotine in their system. Twin and adoption studies have shown the heritability of smoking tobacco is about 60%. Lerman et al. In 1999 found that the people with DRD2 gene allele called 9 repeat allele are less efficient at removing excess dopamine from the synapses, and so they don't have the need for dopamine stimulation. So these individuals are less likely to smoke. The effect management model proposes that smokers strive to regulate their emotional states. Positive effect smokers are trying to increase stimulation. They feel relaxed or are trying to create some other positive emotional state with the cigarettes. Why do they give you a positive emotional state? Well, the one reason is because they increase your dopamine level. But the other level is that you're doing something that is socially acceptable to a certain group of individuals that you're trying to impress. So that gives you this positive emotional state if you have a cigarette in your mouth, and other smokers are looking at you and going, yeah, he's cool, I'm cool too. That kind of a situation. A negative effect smoker is trying to reduce anxiety, trying to reduce guilt, fear, or other negative emotions. So that it has to do with the effect management model. They're trying to change their emotional state. They're trying to maintain a select emotional state. A lot of people smoke because it makes them feel good. And of course, there are lots of reasons why it makes you feel good. It raises your dopamine level. But as you can see, the effect management model and the titration model, of course, could be this. They could both be in effect. An individual would need to maintain a select amount of tobacco or nicotine in their system, and they were trying to make themselves feel better. Information campaigns, successful campaigns, provide non-smoking peer role models, shifts the social prototype associated with smoking. And of course, I watched this. I'm 70 years old. When I was born in 1949, half the population smoked. Lots of people smoked. It was on television. There were a lot of tobacco commercials on television. And then in the 1980s, 1990s, they banned those commercials from television. They banned commercials from magazines. So they had been campaigning to get everybody to smoke, or to get a lot of people to smoke so they could make more money. And now they needed to change the way they needed to start advertising against tobacco. Traditional campaigns have been less effective among ethnic minorities who are targeted by tobacco advertising. There is still tobacco advertising out there. Once upon a time, NASCAR was being sponsored by Marlboro. The Marlboro Man. We used to see those advertisements of this. This guy just died not very long ago, a couple months ago. The Marlboro Man, who didn't actually smoke, oddly enough, and that's why he looked so young, because he didn't age unnaturally because he smoked. Increasing aversive consequences, increase the aversive consequences of smoking, increase the cigarette tax is highly effective, as is increasing the punishment associated with underage smoking. I was overseas. I was in Germany in 1979 through 1982. The Germans were trying to reduce smoking in Germany, and packs of cigarettes were very, very expensive. They were like $5 and $6 a pack, and that really worked for the Germans. So the Germans would ask if they had a friend who was an American could buy them cigarettes, but they couldn't be paid for it. That's against the rules. But if you had a friend who was a German, he would buy you beers, and you would buy him cigarettes. That's kind of one of the ways that the people did things over in Germany. I can remember you could buy a pack or a carton of cigarettes. That's 20 packs. Isn't that 20 packs? Maybe it's 10 packs of cigarettes with 20 cigarettes in each. That's like 200 cigarettes. You could buy that for $2, and you would see a lot of military. Of course, the military gets a discount. During Vietnam, they used to have cigarettes in arcade rations. So we were given there were 5 cigarettes. I never smoked. I've never been a smoker, so I'd trade my cigarettes for candy or whatever. So that's one way you can do it. The aversive consequences. Now a pack of cigarettes is like $7 with all the taxes on it. They're trying to reduce smoking in the United States to reduce the number of people dying, and of course banning smoking in public places. Inoculation programs. You teach adolescents practical skills in resisting social pressures to smoke. The most successful programs are based on a social learning model which focuses on 3 variables that influence the initiation of smoking. One is social pressure. The other is medical information. You can show them a lung that has smoked and a lung that hasn't smoked. And, of course, anxiety that you will catch cancer. A program developed by Richard Evans in 2003 for adolescents uses films, role-playing, and rehearsal. These practice and knowledge sessions help teens develop their social skills and refusal skills. Smoking inoculation in the 7th and 8th grade cuts the probability of smoking in half. Not a bad idea. Even if the kids' parents smoke, you can still inoculate them. Inoculation means give them all of these things to do, and maybe potentially you can convince them that they need to not start smoking. It is estimated that inoculation and cessation programs have saved 3 million lives by keeping children from ever starting and getting adults to quit smoking. Now, oddly enough, when I was in California, one of the things I did was educational research for the RAND Corporation, and we were doing the research dealing with drugs, alcohol, and tobacco. And this is what we were doing. We're trying to find out if this would be successful. So we gave them a survey. We gave them a survey, and then they had these programs came into the schools, and then we went back into those same schools and gave them a similar survey that asked them if they were more or less likely to smoke at this point. So we're trying to determine. It had to do something to do with the Lions Club. Lions Club had this anti-smoking campaign. Anyway, that's one of the things I did over there. I only got in on the beginning of it. I didn't get in on the end of it because my wife was reassigned to, from California, we went to Washington, D.C. We went to D.C., so I had to leave before I was able to finish the second round of the testing. Every day, 4,000 new teens take their first puff. 2,000 of them will become smokers because it is so cool, as you can see from all those stinky kids who are smokers. Programs fall into two categories: addiction model and cognitive behavioral approaches. Addiction model treatments are moderately successful as a standalone treatment. Addiction models, nicotine gum is one way that we can work on this. Transdermal patches, inhalers, Chantix. You see the stupid turkey commercials, cold turkey, and Chantix, and then Zyban, of course. Chantix actually blocks dopamine, and Zyban increases dopamine. My wife's brother, my brother-in-law, tried to stop smoking using Chantix, and because it blocks dopamine, of course, he had a difficult time. He didn't like it. He has a problem with depression anyway, but the Chantix gave him bad dreams because he wasn't. It blocks dopamine, so he wasn't getting the same dopamine in his brain that he should have had. So there you go. I guess if he had used Zyban, maybe it would have worked. Cognitive behavioral treatments. One of the treatments is satiation. It's a form of aversion therapy in which a smoker is forced to increase smoking until an unpleasant state of fullness is reached, and this is known as rapid smoking. They had an episode of what's the one about the bar? I can't think of the name of the bar. Anyway, the one. Well, anyway, they had the star Christy Alley was in that television show, and she had a smoking problem, and she tried aversion therapy where they put her in a room and made her smoke one cigarette after the other, and she loved it. Of course, it was supposed to make her sick, but it didn't work on her character anyway. Interventions need to be targeted to specific groups and take into account cultural traditions, values, and gender, of course. Women are a little bit different than men are. Successful programs with adolescents are those that enhance intrinsic and extrinsic motivation to quit through education and the use of rewards. They are tailored to developmental needs rather than being based on adult programs. They provide social support. Not Friends. What is that television show? Everybody Knows Your Name. Had Norm in it. I can't think of it. It'll come to me in a minute. Make teens aware of their resources for remaining nicotine free. You're all probably listening to this and going, it's this, you idiot. Yeah, okay, I'll think of it in a second. Quitting smoking is determined by three individual factors. According to Liechtenstein and Glasgow from 1997, motivation to quit, including persistence despite withdrawal symptoms. Nicotine as we know, nicotine is the most addictive substance known to man. When people try to stop, only about 10% are successful. This is one of the reasons why so many people are smokers. It stinks, it's expensive. Why in the world continue doing it? It's going to ruin your health, but they do it anyway. And the reason they do it anyway is because of the high levels of nicotine in most cigarettes. Level of physical dependence on nicotine, barriers to or supports in remaining smoke-free. My brother Uh, Nobody in my family, we don't have addictive personalities. So we don't really have alcoholics in the family. We don't have drug addicts in the family. We don't have people that smoke. But my brother married a woman who is from South Carolina, and she was from that area of South Carolina that is right on the North Carolina border, the northern portion of South Carolina. There are a lot of cigarette mills in that area, and because of that, she grew up smoking. And of course, she smokes. It's automatic with her. She doesn't even think about it. So when he went down there and he married her, he started smoking too. It gave them something to do together. Otherwise, standing with somebody who's smoking and you're not smoking feels really weird. Try it sometime. It's not easy. So he was smoking and then he decided not to. He's got other medical problems. He has a spinal problem. And of course, tobacco is a vasoconstrictor, so it exacerbates his problems. So he decided he needed to stop smoking. So he tried to stop smoking, but of course, there were barriers to him stop smoking because she would not. She couldn't, I guess, or she didn't think she could. Anyway, he still smokes, and his medical problems have gotten a lot worse, and it's because he will not stop smoking. And of course, when you tell him that he needs to stop smoking, when I tell him that, he tells me I'm a libtard. He thinks I'm too liberal, and he's very conservative. Before he went down there, before he went down to South Carolina, he wasn't nearly as conservative as he is now. He's almost a Nazi now. The guy's nuts. And that is the end of chapter 9. Okay, now we need to start on chapter 10, Cardiovascular Disease and Diabetes. Very interesting chapter. Okay. Your heart is about the size of a clenched fist, and it weighs about 11 ounces. Not very big. It's on the left side of your chest. This kind of shows it on the right side of your chest. I don't know why they tilted it that way. It's just it's between your sternum and your left nipple. That's where your heart is, right there. So it's on the left side of your chest. The heart consists of 3 layers of tissue. The outer layer is known as epicardium. It's a protective covering of the heart. Epi means over. Endocardium, endo of course means inside, is a maintenance layer between the epicardium and the myocardium, and then the muscles of the heart is the myocardium. And of course, if we look at that word myocardium, myo means muscle, and cardium means heart or heart muscle, myocardium. The myocardium pumps 5 or more quarts of blood each minute through your 4 chambers. I ran 3 miles today, and I ran it fairly well. I don't know. Let me see, what did I run? 28:31 for 3 miles, which isn't really fast, but for a 70-year-old, it's not doing too bad. Anyway, so while I was running, of course, my heart was pumping a lot more blood into my system. I ran on a treadmill. It's cold here and it's windy. We had tornadoes that ran through the area last night, but the storm clouds are still around. The wind's coming from the west. Anyway, it's cold outside and windy, so I certainly didn't run outside. But of course, we're supposed to be quarantined. Not really quarantined. We're in isolation, I guess. We're cloistered here in our houses. So I ran on my treadmill this morning, and of course that was cool. I like running on the treadmill. The heart itself is supplied with blood from a branch of the aorta, which allows blood to pump throughout the heart to keep it supplied with blood and to keep it healthy. If one of these feeder arteries is blocked, then the muscle that it feeds will die and the individual will have a heart attack. This is what a heart attack is all about, is a blockage of one of these blood vessels. As you can see, they're all over the heart. I had a heart attack back in 2010, and my blockage was right here. So if you, and they took a picture of it, as weird as that is, but I've got a picture of the block. Well, there wasn't any actual blockage. What had happened was that I had, I was 60 years old in 2010. Yeah, I was 60 years old. But I'd lifted weights. I'd exercised fairly heavily over 35 years at that point. It's 45 years now. Is that right? That's not right. It was 45 at that point. I'd been lifting since I was 15. Anyway, so some of my blood vessels were bigger than they were supposed to be. They were more expansive. And because of that, when something happened, and we're going to talk about what happened to me anyway later on, but when something happened, the blood there was a kink in my blood vessel that isn't supposed to be there, and that's what happened. Is that thing folded over because there was this kink in there that was created from lifting weights. I don't know if you've ever lifted weights, but when you lift weights, you got to put you throw a lot of blood through your body. You're pumping a lot of blood through your body, so your heart rate goes up. Hopefully, it goes up so that you can do your lifts. Anyway, that's where it was. It was right here, right there. This is the main artery. Left main coronary artery, and it was right there. Circumflex artery, right at the juncture of the left coronary artery and the circumflex artery. And, well, anyway. Cardiovascular disease are disorders of the heart and blood vessel system, including strokes and coronary heart disease. 60 million Americans have suffer from cardiovascular disease, and 34.3% of them will die every year. And of course, they're dying from cardiovascular disease. Now, does this make cardiovascular disease more important than coronavirus? Well, the answer is yeah, sure it is, because more people die from it. But this is something that we've been dealing with for a long time. Coronavirus is an actual viral disease, and it's something that we can control if we're smart. But it looks like we're not being smart, and the number of people dying is doubling every day. We have over 2,000 people that have died. The last time I looked at the figure, and I know this sounds morbid, but I've been looking at obituaries and whatnot for all my life, strangely enough. As soon as I learned how to read, I started reading the obituaries. Not because I was wondering. I've always wondered how long I would live. But I was trying to see what people were dying from. Of course, they don't put that in obituaries anymore, but they used to. They used to tell you whether they died of cancer or whether they died of kidney disease or whatever, or a heart attack. And I remember seeing when I was young, back in the early 50s, a lot of people were dying of heart attacks, or they were dying of lung cancer. And so that convinced me that I needed to do some. They were dying in their 50s, and that just shouldn't happen. Coronary heart disease is the slow blockage of the coronary arteries through atherosclerosis. I do not have atherosclerosis. I do not have a buildup of cholesterol in my blood vessels. Atherosclerosis is a chronic disease in which the arteries that supply the heart become narrowed or clogged with atheromatous plaque. Atheromatous plaque is buildup of cholesterol. It's the LDL. It's the bad stuff. Or it could be triglycerides. Not usually, though, because triglycerides, if I ate a cheeseburger right now and had my blood drawn in 4 or 5 hours, my triglycerides would be up. And that's because all that animal fat would be circulating through my blood, in my blood, and that's what the triglycerides are. Anyway, atherosclerosis is a chronic condition in which cholesterol and other fats are deposited to inner walls of the coronary arteries, reducing circulation to the heart. As we can see, yeah, you can. I'm pointing with my finger. Yeah, this is atherosclerosis, where there's a buildup of fat. Atherogenesis is where the atheromatous plaques form in arteries' inner lining. Oh, sorry. Atherosclerosis is the hardening of arteries. It's, okay. Chronic disease in which blood vessels lose their elasticity because of atheromatous plaque buildup. The body reacts to atherosclerosis by trying to combat it with inflammatory cytokines. One cytokine that we can measure is C-reactive protein, or CRP. Now, I've known about CRP for a really, really long time, because when I was working in the lab, we would identify people with, not people with strep throat, but people who had scarlatina or scarlet fever by doing a C-reactive protein on them. It is just a cytokine it's an inflammatory cytokine. And because of that, because it's there with an inflammation, if you just have strep throat, usually the inflammatory process is very quick. It swells up, you're sick for a couple of days, or you're sick for a week, and then it goes away. We treat you with antibiotics, and you're all healed. But if you have scarlet fever or scarlatina, of course, this is in your system for an extended length of time. Because of that, the inflammatory process is much more extensive, and then your C-reactive protein will be higher. And now we are using C-reactive protein in situations where the individual is suffering from atherosclerosis. So we can see this inflammatory process by measuring their C-reactive protein. Angina pectoris literally translates to chest pain. Pectoris, of course, is chest, and angina is pain. It is a condition of extreme chest pain caused by restriction of the blood supply to the heart. Angina means that there is a blockage in the heart that is causing the heart to malfunction to the level that it causes a tightening of the chest muscles. It may be a warning that a heart attack is imminent. The pain can be relieved with nitroglycerin, and that's one of the reasons why they put a nitroglycerin pill under your tongue. When I had my heart attack, of course, I actually didn't have that much pain, and they kept trying to give me morphine, and I kept telling them the morphine didn't work, but I did let them give me nitroglycerin pills. Nitroglycerin, of course, you can take it all day long, and that's usually, if you've ever watched anybody with angina on television or in the movies, they'll have an attack, and then somebody will put the nitroglycerin tablet underneath their tongue, and the pain goes away. And of course, that's how it works. Normally, what happens, the nitroglycerin only works for about 3 or 4 minutes. It doesn't work for an extended length of time. As soon as the nitroglycerin dissolves, it's all gone. The pain relief is all gone. But what will happen is, once we relieve the pain, then a lot of times what will happen is that the heart attack, or the pre-heart attack, or whatever you want to call it, the angina pectoris, the chest pain goes away. And once the chest pain goes away, then whatever is happening to you stops. However, sometimes it doesn't, and this is known as a myocardial infarction. Myocardium, we've already talked about that. It means heart muscle. Infarction means death. So you can infarct any place in your body. And if you have an infarct in your stomach, of course, that means that your stomach has died, or your liver has died, or your whatever. You can talk about an infarction. So anytime they talk about an infarct or an infarction, it means that something has died. That's usually muscle tissue. Heart attack is the permanent death of the heart tissue in response to an interruption of blood supply. You can live with dead areas in your heart, as odd as that seems. My father had a sextuple bypass surgery done when he was in his 60s. He had all this bypass surgery done, so he actually had atherosclerosis. I already told you that he used to eat bacon and eggs for breakfast every morning. Well, you can do that a couple times a week, but if you do that every day, you're getting a pretty heavy dosage of cholesterol. And there's a reason why he did it. My dad was in World War II, and he landed at D-Day, and he marched all the way through France and into Luxembourg and Belgium and Germany. And of course, they were getting some pretty lousy food. But anytime they came across anything like bacon or eggs, if they could get a hold of any fresh eggs or anything, boy, I'll tell you what, they just really had a heyday especially with fresh food. If you've ever had K rations or not C rations, but K rations, it's processed food, and you get real tired of that after a while. I would imagine MREs are the same way. MRE stands for meals ready to eat. That's what they're eating now instead of the K rations that we used to eat. Anyway, so he had a sextuple bypass surgery. One of them, even though he had six uh, uh, corrections in his heart, one of them didn't take, and because of that, the back of his heart was dead, and he lived for another 30 years with half of his heart dead. He had other problems with his heart. He had when he was born, one of his valves didn't close correctly, and it didn't do this for the most of his life. And then they went in and they gave him a mechanical valve. So my mother would complain that she'd wake up with this thing, opening and closing. It had it sounded like a mechanical thing happening in his heart. He sounded like Darth Vader. His heart did anyway. Anyway, that was kind of funny. She'd complain about it sometimes. Couldn't sleep last night because Nick's heart valve kept me awake, because it made such strange noises. A stroke is a cerebrovascular accident that results in damage to the brain due to lack of oxygen. And that's what they call it, a cerebrovascular accident, or a CA. I know CA is supposed to stand for cancer, but when I was working in medicine, CA usually stood for stroke, because it stands for cerebrovascular accident. Strokes can be caused by a blood clot that occludes blood from getting to a portion of the brain. It can be caused by a hemorrhage where the artery breaks open and bleeds out. Now, this is really important, because there's not a whole lot we can do about hemorrhages, but there's a lot we can do about blood clots. We have the ability now to dissolve those blood clots. About 70% of your strokes are blood clots. So if we know about it, we can give you a medication that will take care of that. Now, once upon a time, of course, we had no idea. We couldn't really visualize these things. We didn't have CAT scans. We didn't have MRIs. We'd have to do what do they call it? A cardiogram. That's where you put dye in their blood vessels. So when it goes to the brain, you can visualize all the blood vessels, and then you can find a blockage. I think it's not a cardiogram. I don't know. Anyway, now we know that there are these tiny little. You've got all these blood vessels in your brain anyway. So sometimes these tiny blood vessels will have a tiny stroke, and this is known as an ischemic stroke. It's a smaller one that only affects a tiny area of your brain, and usually it doesn't really affect you very much. My mother had a bunch of these before she died, and of course sometimes it looked like she was having an epileptic seizure. What she would do, she'd just kind of stop for about 10 or 15 seconds, and then if you talk to her in those 10 or 15 seconds, she wouldn't respond to you. But later, of course, she would say, I think I may have had something may have happened because I couldn't think of anything for 10 or 15 seconds, and then I woke up, is what she would say. Anyway, so hemorrhage or blood clot is real important. There's actually three different types of problems. The other is an aneurysm, where you get a bubble in your blood vessel and then it breaks. I worked with a lady up at Fort Belknap, she's the one that started the immersion program for the Grovan language. And the funny thing was she wasn't Grovan, but I guess that's not that funny. Anyway, she used to have migraines from time to time. Well, what it turned out to be, it wasn't really migraines, it was an aneurysm that was growing in her brain. And a couple of years ago, it just blew. And she was gone quick. I mean, you bleed out, and of course, it destroys all the tissue in the area. Blood's fairly toxic. And she died. She died of a brain aneurysm. This CAT scan is of the brain of a 70-year-old stroke victim. It shows that when blood flow to the brain is blocked, cells in the brain may be destroyed. The darkened area on the right shows where the brain tissue has died because of an inadequate blood supply. The lack of blood can be due to an obstruction in a cerebral artery or to the hemorrhaging of a weakened artery wall. Of course, they don't tell us which one it was in this case. The result is paralysis or weakness on the left side of the body, since the tissue damage is on the right side of the brain. Every minute and a half, on average, someone in America suffers from a stroke. That's about 795,000 strokes a year. And of course, are we going to have that many cases of coronavirus? They're estimating that the number of coronavirus cases is going to be in the millions, and the number of deaths could be as high as 100 to 200,000 deaths. Since 1996, there's been an approved drug called TPA for tissue plasminogen activator that, according to some big studies, can often break up the clot, restore blood flow, and prevent much permanent damage if the drug is given within a few hours of symptom onset. So we have to determine if this is a blood clot. If it's a blood hemorrhage and we give them TPA, then what will happen is that the hemorrhage will get worse. It may open that hemorrhage up again. So you're killing them if they have a hemorrhage. Now, about 70% of all strokes are blood clots. So the TPA is not a bad idea. Of course, you can't just, somebody comes in with a stroke, you can't immediately just give them a TPA to save their lives. It doesn't work that way. If you have to give it within 2 hours. An individual had a stroke on the reservation up at Fort Belknap. This guy had a stroke. Of course, they had to live flight him out to Great Falls. The flight took a couple hours. So by the time he arrived, he was right on the edge of, do we give him the TPA or do we not give him the TPA? At this point, they didn't know whether it was a hemorrhage or a clot. So they couldn't, if they gave him the TPA and it had been a hemorrhage, they would have killed him. But they didn't give him anything. They didn't give him the TPA. The stroke took. There was a lot of brain damage done, and about a year later he died. So people were complaining, because he was an Indian, they didn't give him the TPA. But the reality is, that's not the way it works. You can't guess. It's not that. You can't do that. If you give somebody the TPA and they've had a hemorrhage, you'll kill them, and they die fairly quickly. It's like a brain aneurysm, cerebral aneurysm. When I had my heart attack, they gave me TPA. And the reason they gave me TPA is because the doctor couldn't understand why I wouldn't take morphine, why I wouldn't let them give me morphine. And I kept telling him it doesn't work. And he thought I was crazy. And he thought my insanity was caused by a stroke. I hadn't had a stroke. I'd had a heart attack. So he thought I was nuts, and I finally agreed to let him give me TPA. I didn't have a stroke, so it didn't mean anything. So if you give somebody TPA who hasn't had a stroke, then it won't do anything. It's there to clear out a blood clot that doesn't exist. It's not like it's going to run through your body and blow out something. It doesn't work that way. Anyway, I survived. Electrocardiogram is a measure of the electrical discharges that emanate from the heart. It can indicate whether there is an arrhythmia in the heart. It gives medical personnel a picture of the beating pattern of the heart. And as if you look at this pattern of the heart, this is a normal pattern. As you can see, they're describing everything. And this is a normal pattern. And you can see the normal pattern. You can see the normal pattern in the fast heartbeat. This is even a faster heartbeat. This is what a slow heartbeat looks like. And of course, wait a second. We'll get out of there. Whoops. I'm on the wrong slide. Let me get out of there. Now I've lost it. There we go. Okay. It's off the chart anyway. Sorry. The irregular heartbeat. I'm going to show you an irregular heartbeat in a minute. This is what a normal heartbeat looks like, as you can see. It's the same pattern over and over and over and over and over and over and over again, as long as you don't have an arrhythmia. Well, we're not showing arrhythmias here. Okay, here we go. See, this is a normal heartbeat. So this is what you're looking at when you see a heart tracing from the EKG. This is the heart attack is starting. Here the heart attack's in pretty bad shape right here. This is what is called a T inverted. They also call this a tombstone, and this is what I had when I had my heart attack. This is what my heart looked like. When they went in and fixed me, they said I had about a 93% occlusion, which means I was only getting my heart was only getting about 7% of the blood that it needed. I had a friend who had a heart attack a couple of years ago. I talk about him all the time. He was from West Virginia. Anyway, he had a heart attack, and he only had a 10% occlusion, but he wasn't real smart. He was fairly brilliant, but he was one of those guys that follows whatever everybody else is doing. So when Danny had his heart attack with only 10% occlusion, he had smoked most of his life, and I've never seen anybody consume as much greasy food as he did. He wouldn't stop, and I kept telling him he needed to change his ways, to change his lifestyle, and he never did, and he died of a heart attack. But he only had 10% occlusion. He only had 97% occlusion. He only had 90% occlusion. I had 93% occlusion. And of course, I have no damage whatsoever. Anyway, so this is what a heart attack looks like. This one right here especially. And this one, of course. This is what they call a tombstone. Or a T-wave. Your T-waves are off is what they'll tell you. Or sometimes they'll just wink and say tombstone. And of course, unless you're a medical person, you have no idea what tombstone means, but this is what it means. Usually that means your heart attack is pretty severe. And mine was. It was relatively severe. And maybe the TPA actually helped me. I don't know. Cardiac stress tests. I've had a couple of these since my heart attack. Cardiac stress test is administered to watch the heart under stress to determine if there's any blockage. I had one of these done just before I started at Ashford, and the doctor decided that he needed to put another stent in. And I'll show you what a stent is in just a second. A stent opens up a blocked area in your heart. In my case, it was because I had an extra curve in my blood vessel. But normally it has to do with blockage of one kind or another. I guess that's a kind of blockage, isn't it? They not only do an EKG while under the stress, but they also do an echocardiogram to get an image of the heart after the stress. So what you do is you walk on this thing. I took it right up to the max. They don't see people that run as much as I do normally. It's usually older individuals who are fairly infirm, so they can only go a certain rate. What you do is you walk until your blood pressure goes up, or actually, what they're looking for is your pulse. They're trying to determine if your pulse is how high your pulse is. And I was running my 3 miles today. And every once in a while, I'd grab the grips, and the grips would tell me what my pulse was. And my pulse never went over 100 during my whole run. That was kind of good. That was kind of fun. Coronary angiography is a diagnostic test in which dye is injected so that X-rays can reveal any obstructions in the coronary arteries. Cardiac catheterization is then used to repair any blockage with angioplasty, where the plaque or clot blockage is reduced by pressing it against the arterial wall with a balloon, or they can open up the artery with a mesh cylinder called a stent. The reason they're way down here on his leg is because that's where what they'll do is they'll cut open your leg, and they'll find the femoral artery, and that's where they run the catheter. I woke up during surgery one time. That's has to do with my lack of sensitivity to not to heroin, to opiates. Anyway, I woke up during surgery. It felt like I had a garden hose running down into my heart. Anyway, they run it up the right leg, and then it goes down into the heart. Of course, the heart's on the left side, so it has to cross across. That's what I remember the most is the pain in my clavicle, right under my clavicle. That's where the artery that runs across into your heart. They don't run it up into your brain. And this is what angioplasty looks like. As you can see, he's got the plaque buildup, and they run the catheter in there, and then they blow out the balloon, and the balloon squashes the plaque up against. It smashes it. And this is what a stent looks like. It's just a wire mesh, and they run it up there, and then they shoot another balloon up there, and it puts it somewhere in the heart. And of course, this one is here. Mine was there, and I've had several stents along this major artery right here on the left side of my heart. Anyway, I think I have 3 in there. Maybe I have 4. I've lost count. There are medications that you can take for high blood pressure and to help cardiovascular disease. One of them is known as a beta blocker. Beta blockers block the action of endogenous catecholamines, epinephrine and norepinephrine, in particular on adrenergic beta receptors of the sympathetic nervous system, which mediates the fight or flight response. So my beta blocker, I actually take a medication for my blood pressure that is a beta blocker. It's called metoprolol. It's a beta blocker. Calcium channel blockers are medications that disrupt the movement of calcium through calcium channels. Vasodilators are drugs that relax the smooth muscle and blood vessels, which cause the vessels to dilate. Anticoagulants, antithrombics are a class of drugs that work to prevent the coagulation of blood or of clotting of blood, clotting of blood. Plavix is an anticoagulant. Heparin's an anticoagulant. Why can't I think of that? Warfarin is an anticoagulant. Those are usually what you give people. If you're trying to dissolve a clot, you usually give them heparin. If it's long term, you give them warfarin or Plavix. And those are anticoagulants that thin out your blood. If it's really long term, like I am, they give you aspirin. Aspirin thins your blood. I take a baby aspirin a day, and it acts as an anticoagulant. Thrombolytic agents are medicines that dissolve blood clots in a procedure termed thrombolysis. Heparin is a thrombolysis. Warfarin, I don't know. I don't. Yeah, well, if somebody ever has a blood clot anywhere, they will put them on warfarin. They'll put them on something to thin their blood out. Usually, Plavix is a relatively short-term thing. Coumadin, that's the word. Warfarin and Coumadin are the same thing, but they'll use Coumadin for long-term usage. The problem with Coumadin, I guess Plavix is worse, but Coumadin is builds up in your system, so you have to keep monitoring it like every month. My dad was on Coumadin, and he had to go in and have his blood drawn, and it's a special blood draw that they have to do. And if you don't have very good veins, it's kind of tough. That was one of my specialties when I was a phlebotomist. I was really good at drawing blood clot tests for Coumadin. Coronary artery bypass graft, open heart surgery is open heart surgery in which a small piece of healthy vein is grafted around a blocked coronary artery. This is what happened with my dad. He had 6 blood vessels that they tried to fix. 5 of them took and 1 of them didn't. This type of surgery is only used when the blockage is so severe or extensive that angioplasty is contraindicated. And of course, this is a possibility. They don't really like to crack chests anymore. Now, of course, they try to use heart catheterization in order to fix something. If they do have to crack your chest, it means you're in pretty bad shape. But like I said, I've had 3 heart caths. I had a friend that told me you can only have 3 stents in your heart. And he just died of a heart attack. And I've got 4, so I guess he was wrong. I've got 4. Annual U.S. cardiovascular disease mortality. Although the mortality rate for cardiovascular disease has decreased in the United States and other affluent countries, it has increased in Eastern Europe and the developing world, and that's because of tobacco, as stupid as that sounds. And in Europe, for instance, the cardiovascular disease mortality rates range between 981 and 1,841 per 100,000 people. In the Western Pacific, South and Southeast Asia, cardiovascular disease mortality rates are as high as 3,527 and 3,752 per 100,000 people, respectively. And this is according to the World Health Organization in 2000. As you can see, those are pretty high. We're going to talk about the United States right now. The Framingham Heart Study began in 1948. It was a landmark prospective study of demographic, biological, and psychological risk factors in cardiovascular disease. When the study started, the death rate from cardiovascular disease in the United States was 500 out of every 100,000 people. This peaked in 1950 at 586.8 per 100,000 people. The cardiovascular disease rate has been dropping ever since due to the information acquired from this study. And one of the pieces of information was cholesterol. Well, how did we come up with that? And I'll tell you about that in just a second. Let me put these in perspective. Right now in New York, with the coronavirus, 305 people per 100,000 people are actually getting the disease. Arizona is at 13 people per 100,000. Florida, where my son is 20 per 100,000. And Iowa is 11. And that's the reason I'm here instead of there. For one thing, I don't want to travel. I am immunocompromised, not just because of my heart attack, but also because of my lack of a spleen. I am susceptible. Theoretically, I'm susceptible to this stuff. I never get sick, however. I never catch the flu. I never get colds. So I'm thinking that I may be immune to this as well. If we look at coronavirus deaths in the United States, 1.8% of the positive tests have died. So that's the death rate. But of course, we don't know all the people that have coronavirus because we don't have enough coronavirus tests to test everybody. So if you want a coronavirus test, tough luck. You've got to have the symptoms or they won't even test you. And now they've decided not to test people that they know have coronavirus. They're not even testing them for coronavirus anymore. We won't go into that. The government's really dropping the ball on this one, unfortunately. And they're leaving it up to the states. Risk factors, uncontrollable risk factors. You can't control your age. You just keep getting older. You can't control whether you're a male or a female. You can do you can be transgender. It's not going to make any difference. You're still going to have the gender of your birth. Family history of heart disease or of cardiovascular disease, and your race and ethnicity. There are some people that are more susceptible to high blood pressure and whatnot than others. Controllable risk factors, hypertension. You can lower your blood pressure by taking blood pressure pills like I do. You can try to control your body weight. You can keep it down, keep your BMI down. You can eat healthy foods and not eat that cheeseburger up there. Doesn't look that good, does it? If you smoke, it's the dumbest thing in the world that you could do. It adds to cardiovascular disease and, of course, your cholesterol level. You can control it. If you can't control it with your diet, then you can always take statins that lower your cholesterol level. Family history and age. Family history indicates a genetic proclivity for cardiovascular disease. Risk factors. You would think that since my dad had a heart attack and I've had a heart attack, that my family is susceptible to heart attacks. But the reality is I have 5 brothers and sisters, and none of them, one of them died of cancer, but nobody has died, else has had a heart attack but me. I'm the only one. First degree male relative who had a heart attack before the age of 55. First degree male relative is your father, your mother, or your brothers and sisters. And of course, I had my heart attack at 60. So did my dad. So that shows that there is no family history. I keep hitting this with my ring. I'm sorry. First degree female relative who had a heart attack before 65. And of course, I don't have that. And half of all heart attack, it says half of all heart attack victims are over the age of 65. And of course, I was 60 when I had mine. Cardiovascular disease is the leading cause of death in the United States of both males and females. Men are over the age of 40 are especially susceptible to cardiovascular disease. Gender differences in cardiovascular disease may be due to sex hormones, the difference between testosterone and estrogen. Testosterone is linked to aggressiveness, competitiveness, and other behaviors that may contribute to cardiovascular disease. Levels peak during early adulthood, just when gender differences in mortality peaks. And there you go. You can see the difference between the number of deaths due to cardiovascular disease and the number of deaths due to breast cancer. And breast cancer is one of those things that as you get older, it doesn't mean that you're more susceptible to breast cancer. It seems to be genetic. But with cardiovascular disease, there's a huge, just a rapid uptick as you get older. And where am I? I'm 70, so wait a minute. I'm right here. As I get older, my probability of having a heart attack is even higher. Women are twice as likely as men to die following a heart attack. Women with cardiovascular disease tend to be older than men with cardiovascular disease. Before menopause, women seem to be protected from cardiovascular disease by estrogen. Men receive more aggressive diagnostic and treatment procedures, and so women complain that they're not getting the same treatment that men are, but the reality is that men are more susceptible to cardiovascular disease than women are. Compared with the European Americans, African Americans are at an increased risk, and Asian and Latin Americans are at a lower risk of cardiovascular disease. People of low socioeconomic status tend to have more total cardiovascular disease risk factors, including high-fat diets. You need to be careful. Don't eat the food coming out of the gas station at Saley. Lack of exercise. You need to exercise 4 or 5 times a day, and we're going to talk, or 4 or 5 times a week. If you smoke, stop. It's really dangerous. Lack of access to health care, and stressful life experiences. Of course, you guys have IHS, and it's about time to stop. Why don't we stop right here? We'll stop right here, and there it is. Okay. Well, and I'll see you guys on Wednesday.